Hi
Kim.
there.
See you, friend.
Good to see you. I'm excited about tonight.
Me too, very much. Hey guys, I want to introduce you all to Kim Palmer. She is a local friend and a nurse practitioner at a local clinic, and she has a heart for wellness. We sat down and had lunch the other day, and we just got to talk and talk, and loved hearing how she serves her patients with natural remedies when possible. Of course, there's always room for all the kinds of medicine.
Absolutely.
Yep. But she does love a good natural remedy when people are open to it and when it fits the situation. So, all right. Well, she's going to talk a little bit about hormones, and I want to invite all of you to tag your friends below. Make sure they don't miss this. This is going to be an hour that um, uh, they will want to get the information. So make sure you tag your customers, tag your guests, tag your friends. And then what she's going to do, she's going to talk to us about some hormone things. And then we're going to pause a little bit for the questions. So put your questions below. We will get to them. But we're going to let her talk a little bit, and then we're going to take a break, and then just kind of go back and forth. So that's going to be kind of the cadence of what we're going to do tonight.
Okay, so I'll tell you a little bit about myself and why I joined Jordan Essential Oils, because I'm really careful about what I do and what I share with people because I am a nurse practitioner and I don't want people saying, oh, that nurse practitioner told me to do this. So I'm very careful about the products that I use, the products that I share. So I want to set that out there to begin with. So I'm 55. I'm just going to put that out there. So I have been through that menopause transition. My 1 year was in December, so I've had all of the symptoms that I'm going to share with you tonight. I joined Essential Oils. I met Kim at a setup at Christiana, and I was struggling with that sleep. And I know one of the things that helps with sleep is magnesium, and she had magnesium lotions. So I got one of the magnesium lotions from her. And then I have a grandson with special needs, and he has seizures. And he had a really rough summer. He was growing, and his medicines weren't working quite right. And he ended up in the hospital for quite a few days, and he had some muscle cramps and issues. And I used that same magnesium on him. Now, I don't know. He couldn't tell us if that helped him. It helped Gigi. It helped Gigi because I felt like it made him feel better. So I've used the magnesium lotions. And then just in December, we had this great special that was running that you could get a kit for $24.99. And I thought, well, I'm using this lotion. Maybe I'll do this. I'll just jump in and get the kit, and because it had great products in it, and I'll just use it for my discount. But then as I started getting to know the products a little bit more, I decided, well, why not share some of these with some people because they are really fabulous. And we're going to bring some of that in as some of these supports for your hormones as we go through this. I don't know how many of you, several of you participated in some of the posts that I did for some of the engagement posts. One of my favorite was the caricature posts. And I did that intentionally. I did it for tonight because I wanted to have a little peek inside your life. Because when I have a patient, when someone's sitting in front of me, that's one of the things that I want to talk about. I want to talk about, well, what do you do? How do you spend your time? How are your symptoms interfering with those things that you like to do? And what I learned about you guys is that you're all really busy. You're busy with babies. You're busy with work. You're busy with family. You're busy with animals. You're busy with hobbies and fun things that you like to do. You're in a busy season of life. And that adds to some of our hormone changes. So let's just dive right in and talk a little bit about the perimenopause, menopause, and then postmenopause. So first and foremost, this is a transitional phase. It is a natural phase that happens. Nothing is broken. Nothing is wrong. This is something that we all go through. Perimenopause can actually start 5 to 10 years before you actually have periods that cease. So very early on in your 40s, you can start having things like all of a sudden you can't sleep anymore at night. You might be, oh, my skin is drier than normal. My hair's thinning a little bit. What's going on? your attention span gets a little bit shorter, and maybe even your reactions get a little bit quicker. I tell my husband all the time, I'm sorry, honey, there's no estrogen filter anymore. It comes out. Whatever's there in my head, it's just going to come right on out now. But that can start very early in your 40s, and then it can progress on. And what is happening is actually your hormones are fluctuating. You're not you're deficient of your hormones. They're just going all over the place. Like one month you may have too much estrogen. The next month the estrogen may fall and the progesterone may take charge. The next month the progesterone may fall and the estrogen takes charge. But here's the background that not a lot of people know. The hormones are changing, but that changes your other hormones. And one of the biggest drivers of all of the issues is insulin resistance and cortisol, raises in your cortisol level. That's what estrogen buffers those two things. Estrogen makes you more insulin sensitive. When you're insulin sensitive, you can break down the carbohydrates, you can break down the sweets. You know, I remember when I was in high school, I could have a Dr. Pepper and a Snicker bar for lunch every day and never gain a pound. And if I did gain a pound, I could skip that Dr. Pepper and that Snickers bar one meal and get back into my size zero jeans. It was easy, no problem. But as you get older, all of a sudden you're like, something's wrong here. I haven't changed my diet. I still doing the same things that I do, but all of a sudden I'm 5 pounds heavier. And you're like, it's just 5 pounds. But that 5 pounds comes into 10 pounds, and that 10 pounds goes to 15 pounds. And then you're like, I can't fit in my jeans anymore, and I can't skip a meal and get back in them. Something's wrong. If I don't eat, I'll gain weight. If I do eat, I gain weight. And nothing, it doesn't matter how much cardio you do. It doesn't matter how much of anything that you do. And I'll tell you why. We're going to go back to that insulin resistance. As your hormones are shifting back and forth, you become more insulin sensitive. So you're insulin resistant. So your body isn't breaking down foods the way that they did in the past. That cardio that we all thought we could do to help us lose weight causes your cortisol levels to increase even more. And that estrogen isn't buffering it anymore. So that actually works against you instead of for you. So all of these things work together to cause some of the symptoms that everybody has during
So are
menopause.
you saying that I don't have to exercise anymore, Kim?
Oh, no, ma'am. I am not saying that. We are going to change the way that we exercise.
Okay.
So, what women need, and this is so important, and this is another one of those key things. So, what insulin resistance does and what high levels of cortisol do is cause you to lose muscle mass. Muscle mass then leads to lower metabolism.
Yes.
So then instead of that cardio working for you, it's working against you. So you have to change the way you think. You still need some cardio, but the cardio that you do needs to be done in such a way that it's not that high impact cardio. You want to stay in zones 3, very little in zone 4, and no zone 5, because zone 5, that highest maximum impact of your cardio, that's where you're going to cause the most cortisol rise. But you switch to strength training because strength training builds those muscles back. The other thing that it does is it protects our bones. So you need to be lifting weights. If you haven't started yet, it's easy. You can start with body weight exercises and work your way up to weights, but you do need to lift some pretty heavy weights sometimes to be able to keep your bones and your muscles strong. And then that helps you with insulin resistance. It causes you to be more insulin sensitive, and it lowers those cortisol levels. So we talk about these and think about the other things that happen. Estrogen also helps with your joints. So as that estrogen level kind of shifts and turns, your joints hurt, your hips hurt. How many of you have woken up in the middle of the night with horrible hip pain? You can't even lay on your hip. It hurts so bad. So you think about when we're in our childbearing years and we're having babies, Our joints need to be really pliable. So as our bellies grow, as we have the babies, our hips need to expand and contrast so that the babies can come out. But as we lose our estrogen and we're no longer in those childbearing years, our joints don't need to do that anymore. And then the estrogen's gone. And then our joints hurt, and especially our hips. There's not a lot of things as a doctor, as a provider, as a nurse practitioner that I can give you to help with that joint pain because it's such an internal deep pain. I can give you some meloxicam. That's an NSAID. It affects your kidneys. There's other things that you can do to help with those aches and pains. So I want us to take a minute there. We've been talking for quite a few minutes, and let's look at some questions and see what questions you guys have or what thoughts you have right now.
Dawn says she drinks a cortisol tea in the morning and at night. Do you know anything about that?
So there are some cortisol teas out there that help lower your cortisol. Tell me what's in it. What's in your cortisol tea?
Okay, Dawn, can you type that out for us? She said her mother also has horrible hip pain right now.
Yes.
Cindy has hip pain.
Uh-huh.
Okay, we don't have any questions at
No
this point.
questions yet. Okay. So let's talk about some things. Let's take a minute to talk about some of the biggest impact for some of our Jordan essential oils and also some of the things that happen. So let's go back to that sleep. Let's start there. So sleep sometimes is one of the first things that you notice when you enter this perimenopausal phase. All of a sudden, you can have like a gold medal in sleep. When I was young, I had this, I could sleep and I slept well. But then all of a sudden, I couldn't sleep anymore. It's like, what is wrong? Why can I not go to sleep at night? And if I do go to sleep, why am I waking up in the middle of the night and staying up for hours? Um, so, but some of the things that can help with sleep is magnesium. Magnesium is one of the things you can take it orally. You can use it topically. So when you look at our Jordan Essentials, the main thing that they started with 26 years ago, it is their 26th anniversary, was the magnesium and bringing magnesium into topical forms. So the magnesium helps with muscles. It helps the muscles relax. It has a calming effect. And most people are deficient in magnesium. And then I have another question for you. How many of you are taking vitamin D? Anybody? Everybody? Hopefully.
I used to.
Everybody? Everybody should be taking vitamin D. But did you know that in order for vitamin D to be absorbed correctly, you have to have appropriate levels of magnesium? So they're partners. So we have one of our Jordan Essential products is the Jordan Essential Magnesium Lotion. For sleep, it has lavender in it, right? That we have
Yes.
lavender in it. So it has
Lavender, sweet
lavender.
orange, and chamomile.
So those are all great. And I'm sure the cortisol tea that you're drinking probably has some chamomile in it, hopefully. Maybe some sunflower or even taking vitamin D. I see somebody's taking vitamin D. So the cortisol teas are great too. And then you can use the magnesium lotion at night to help with sleep, to help with those muscles, and to help better absorb that vitamin D. Now, it's really hard to get vitamin D drawn in labs because your insurance doesn't necessarily want to pay for it. When it does, and your doctor comes back and says, "Oh yeah, your vitamin D looks good. It's like 30." You really want your vitamin D up closer to 100. That's when you're really going to feel good. So to get it up those numbers, you have to have the D3, the K2, and the magnesium in order for that to work. Vitamin D is important for our bones. It's important for our muscles. So putting those products together and getting the right amount of sleep and using some of these essential oils to help with that is very powerful. Questions about that? Our sleep line is new. This is new with this spring and summer. So it has the stick and it has the lotion. Is there a spray yet for the
We've had
sleep?
the spray for a while, but we
Okay.
teased everybody with the lotion this last
Uh-huh.
year a couple of times, and
Uh-huh.
it was such a hit, they decided to bring it into the full line.
Okay, perfect. So, what questions do you have at this time? Any questions yet? Vitamin D was 4. Oh my goodness, that's like almost saying it was 0. You didn't even have any vitamin D, right?
Wow.
Um, so let's talk a little bit about some other things. Let's go to that hip pain now. What are you doing? What is your mom doing for the hip pain right now? Or what are you doing for hip pain? What has anybody tried?
A lot of people are saying me about the hip pain.
Hip
So
pain.
I'm interested to see what they're doing. If they're taking analgesics, or if they're taking, or if they're finding. I know Dawn said she has gotten way better in the past month by using the magnesium lotion.
Yes. So, a couple things. We're going to go back to that weight training. That's one of the most important things that you can do is the weight training. The body weight training, squats, lunges, you're strengthening your core. So that helps you stabilize your hips. Stretching, yoga, and then the magnesium. One of my favorite things is kind of a layering type of approach. We talked about our Jordan Essential box. I think several people have talked about the JJ box this month. It's a great one. It's got the Copa-Calm. I love Copa-Calm, and I'm going to tell you a couple of secrets about the Copa-Calm. One, I've been using essential oils for years. I started having the hip pain when I lived in Japan. My husband's military, he's retired military, and we lived in Japan for several years, and then we lived in Europe after that. So I kind of had a taste of Japanese medicine, which isn't really medicine, it's more Eastern medicine, which I absolutely love. And then Italian, also very natural. So I got really interested in the essential oils. Copaiba is in the Copa-Calm. Copaiba is actually a natural NSAID. So an NSAID is a non-steroidal anti-inflammatory. So it has anti-inflammatory properties. Now it calms you. It's great for stress. So cortisol equals stress. And when our estrogen levels start doing that ping pong up and down, it causes the cortisol not to be softened because estrogen softens the cortisol and kind of keeps it in check. So when our estrogen isn't doing exactly what it's supposed to do, then the cortisol levels go up. So that causes an increase in anxiety. One of the things that several of my patients have said is that they'll come and they'll say, like, Kim, I am so anxious and I have no idea why I'm anxious. All of a sudden, I've never had anxiety my entire life, but now I have anxiety. And I went through that too. I started having panic attacks. I've never had a panic attack in my life. And I started having panic attacks as I kind of went into that. So I kind of went a roundabout way to talk about the Copa-Calm. But the Copa-Calm is good for helping reduce the stress level. It evens things out, but then it has that anti-inflammatory in it. So the Copaiba, when you layer that with the Helio, let's talk a little bit about helichrysum. Helichrysum is the main essential oil in the Helio. Helichrysum has so many major, so many great properties to it. It can reduce the inflammation. It brings your blood to the surface. It helps your body respond in better ways. It's great for your skin. So it helps everything to be recovered and restored. So if you have a muscle strain, helichrysum is great for that. But if you layer the Copaiba that has the magnesium with the helichrysum that also has the magnesium, you get a great little punch to those hips. Yes, ma'am.
Sue Ellen taught us something last year about these two, and why to layer them. She puts the Copa-Calm on first, and then
Mm-hmm.
she puts the Helio on top, because the wintergreen in the Helio will drive everything down deeper.
Absolutely. And then if you added a little bit of frankincense and lavender in on top of that, you have this great little mixture of stuff
You know
that's
what?
going to
You
be
could add
amazing.
the what who is this? Jennifer Wilson just bought the Renew cream with magnesium, the
Yes.
shea butter
Uh-huh.
cream, which is my
Yes.
favorite pain cream. And you could put that with the Helio on
Hmm.
top of the Copa-Calm, because it has frankincense, basil, lavender, and I think peppermint.
So, and I'll tell you a story about that. It has nothing to do with hormones. My teenager blew out his knee playing football, and he had to have a complete knee redone. He tore his ACL, he tore his MCL, he tore his cartilage. He did about everything you could do to it. So he had to have it completely reconstructed. I let him have his pain medication, the opioid, one time. He had the day of his surgery. He took that night so that he could sleep. The rest of the time, I mixed coconut oil with frankincense, copaiba, helichrysum, lavender, and peppermint, and I used that on his knee. That is the pain medication that he had after having a major knee surgery, and he didn't need anything else. He was back playing football 6 months later.
Wow.
In his scar today, you don't recognize it and you don't notice it as much because that frankincense helped with the skin repair along with the helichrysum because it got all of those things together.
Mm-hmm.
So that's just kind of a little aside, but um, it really does make a difference when you're using it in a different way. So, okay, so I have a question from another participant that's here, and she was asking about what makeup that I use. I haven't I haven't dived into the makeup with Jordan's essential oils yet, so I'm sure somebody else could talk about those. I use OG right now. I'll just be honest, that's what I use right now, and I don't use a lot of it. I don't use a lot of makeup. Um, OG is another one of the natural products. We have a line. I don't know anything about the makeups because, like I said, I've only been doing this for about a month. But if you want
We
to talk
have
about,
really good ones.
uh-huh.
Our tinted moisturizer is phenomenal. It's got flakes, flecks, or whatever in it, which reflect the sun. So it's kind of like a natural SPF. We don't say SPF because we're not certified with the Food and Drug Administration to say SPF, but the minerals that we put in the products do repel or reflect the sun away. So that's really nice. We do have a BB foundation that's heavier. If you want something heavier, I usually just use the tinted moisturizer when I'm going to. And then, of course, the mascara. I've had lots of customers say that they love the mascara and the makeup because they don't make their eyes water and burn when they put them on because there's no garbage in them to irritate you. And then I have let's see, the lip balms are wonderful too.
I just started. I had a lip balm. Was in my last one. I got the cherry that's got a little bit of color to it, and I love it. I've used it all day today. I'm a kind of a lip balm. I'm kind of addicted to them, so I've
And if
used
you
it
get the
all day
large
long.
ones, they're the same size as our sticks
Uh
and they
huh.
last forever. And you can swipe both lips with one
Oh, well,
swipe.
there you go. Just one swipe there. So that's a great question, Myra, about that. So you can check that out. But I think sometimes it's not necessarily just the makeup, it's what you're putting on underneath your makeup. The combination of the scents that can come into those can cause some reactions to sensitive people. So I think if you have the right base, and then we can talk about all of the different things, our hydrating toner. I've been using this for several days now. It's brand new. I love it. It's probably one of my most favorite things. So it smells. I love the way that it smells. It's got the magnesium in it as well. And then the natural retinol that's in it. So the toner has been great. I've enjoyed that a lot. So, that's another one of the things that we find as our hormones shift and change. And it's not, I'm going to go back and tie it into another hormone. Another thing that happens as our estrogens shift, as we become more insulin resistant instead of sensitive, and as our cortisol levels go, our thyroid becomes not as sensitive as it was. So when your thyroid doesn't work quite right, it slows everything down. So one of the things that it slows down is how the dead skin sloughs off. So your skin becomes drier. So you have dry skin, your hair can thin, and you can go to the doctor and have your thyroid tested, and they'll be like, "Oh, it's fine," but really, it's like in the threes, and that's pretty close to 4. I think anytime your thyroid is over like 2.5, that's your TSH. If your TSH is over 2.5, your thyroid is not functioning exactly the way that it should. This is more of a functional medicine kind of thought process. So let's talk about ways that we can handle that. The skin gets dry, so you want to make sure that you are using proper skin care to keep your skin from being so dry. So the Hydra Glow products have been great. I've been using them for about 3 weeks now, and I'm a pretty big skincare snob because I think your skin is so important, and I work with sick people. So I've used Zeo products. I get them at the spa. I don't know if any of you have heard of them. They're super expensive. So but I think because I'm with the public all the time, I'm with patients who are sick, I have to keep my skin. That's your first barrier of defense against illness. So I have been using the Hydra Glow moisturizer. There's a product in the Zeo line that's called oh, I don't remember what it's called, but it's my very most favorite thing, and I love it. I love this just as much, and it's a third of the price. And I think my skin has not, it's been great with it. You know, I haven't seen a whole lot of changes. So it's a third of the price and there's more in it. So I think I'm going to be sticking with this. So, I think Kim Palmer,
Yay.
you are a snob when it comes to face care. Yes, ma'am, I am. Um, but anyway, so our line, I'm gradually switching over to it. The other thing that I absolutely fell in love with, and I didn't think I was going to like it, but I wanted to try it because I was fascinated by it, is the Hydra Glow Cleansing Balm. I love this. I love the way that it smells and it feels so good on your face. Um, you put it on, and then I take like a nice, steamy, warm washcloth and just kind of let it sit and it takes off all the makeup. And then sometimes I use another cleanser after that. Sometimes I don't, but I've really enjoyed it.
Kim, you can use the cleansing balm at night
Hmm.
and use your steamy rag and wipe it off, and what's left will be a nice night cream.
Ah, so that's been really great. So I like it, and I do like the smell of it too. Um,
Oranges.
Oranges, yes. And then when we continue to talk about our skin, it's not just our face; it's the skin on our hands, the skin on our legs. It gets really, really dry. The Skin Relief has been a wonderful little product. The Skin Repair has been great. I'm still waiting on what? Somebody
Oh,
just
for her
said,
hydroglow system to be
oh,
delivered.
oh, okay.
It's been delayed, so she's not had it.
Oh no. So the Skin Relief, I really do enjoy this too. We've been using it in a different way. I'm going to go back to my grandson. He is 100% tube fed, and that's a new thing for him. And he's never really had processed foods before. We always do whole foods with him, and now because he's tube fed, he has processed food, and his skin is horrible. It has just he's developed eczema just in the short time that he's been on it. So we've been using the Skin Relief on him, and it has cleared up his eczema better than what the doctors had provided for him. So love this stuff. But when your hormones are shifting and your thyroid isn't working quite right, your legs get really, really dry and itchy and disgusting, and you can't wear shorts anymore because your legs are so yucky. This stuff takes away all of that dryness and really helps. The magnesium alone, just the magnesium, is so good for our skin. So when we think about how to protect our skin and how to balance out some of the different hormones using the different magnesium, can be really powerful.
You
So
know,
somebody's,
you could actually use that toner, the new Hydroglow toner,
uh-huh.
because it's got the magnesium that resurfaces the skin. And it's got some other really good skin properties. The skin relief spray would be good. And then, of course, that skin relief cream is a miracle.
It
Like,
is a
I cannot, I
miracle.
have some kind of eczema or psoriasis on one elbow. And as
Hmm.
long as I keep that on there in the morning and at
Hmm.
night, I don't have any problems. It looks like normal skin.
Yeah, I see somebody says alligator skin. I can't see the whole quote. What does it say?
As I call it. We
Alligator
did,
skin.
we do have a
Yeah.
question. How can
Okay.
we lower cortisol?
Okay, that's a great question. So, cortisol is the stress hormone. So, high cortisol causes worsened insulin resistance. It causes more disruption in the sleep. It causes increased adipose storage in your belly. So, have you noticed that when all of a sudden your hips kind of get narrower and everything kind of comes into the middle? And then you have like, you look, well, I look 4 months pregnant now, because you've got this belly fat that you didn't have before. That's visceral fat. And that's caused by that cortisol. It's triggered by anxiety and mood changes. So what are some things that help calm? We already talked about the Copa-Calm. That can help with reducing your stress. And when you reduce your stress levels, then the cortisol levels come down. The other thing is proper sleep. You've got to have proper sleep. That helps with insulin resistance. That's when your body does all of its repair work. So if you're not sleeping, then your body doesn't have time to do its repair work. So, and sleep is not something that we need to take for granted. You need 7 to 8 hours of sleep, and it needs to be solid and it needs to be consistent. And that's going to be the key word for you, as for all of us as we're going through menopause, postmenopause, is consistency. You pick your routine. You need a sleep routine. What do you do before you go to bed? You take you try to keep the same time at night to go to bed. You try to keep the same time to get up in the mornings, and you get that solid time of sleep. Cut out screen time, at least 30 minutes. That's the TV, that's the phone, that's the computer. We need to go back to the old fashioned. If you need to have something to relax your mind, read a book, have a conversation. Those things can help you settle and be ready for sleep. That signals to your body, I'm ready to sleep. That could be your skincare routine at night. So you take your makeup off. It's one of the last things you do. You take your makeup off. You put your skincare products on. You brush your teeth. You use your sleep magnesium or the Copa-Calm or a combination of the two. The other thing that you can do is you can diffuse some of the essential oils. We have essential oils. You can diffuse the lavender, and that helps you to sleep as well. Um, all of those things can help you lower your cortisol levels. And let's go back to the exercise, changing the way we think about exercising. Walking is a great way to get your heart rate in that zone too. So if you can take, even if you don't have the time to get a full walk in, if you can take 10 to 15 minutes after each meal to take a walk, then that can help lower your cortisol levels, improve insulin resistance. It can make you more insulin sensitive, especially right after meals. And then switching from that high impact cardio to more of the strength training, yoga, meditation, deep breathing, all of those things can help lower those cortisol levels. And the getting rid of the belly fat, that helps lower it too, because that keeps everything in. But sleep is one of the main priorities that you've got to be ready to do. So my regret in life, what's that? What's your regret in life? I can't see the other half of the comment.
She said, my regret in life is not taking care of my skin when I was younger. I always thought I had plenty of time before I needed to start a skincare regimen. It's never too late, Dawn.
Mm-mm.
You're doing it, and that Hydro Glow, you're going to notice a marked change in your face.
It's
Pat
never too late.
Schultz said, what's with the dreaded witching hour of waking up at 3 a.m. without fail? Is that cortisol?
It is absolutely cortisol. It's cortisol and insulin resistance. We talk about night sweats and hot flashes. When you think about night sweats, that's usually poor glucose control. So if you notice when you've had a meal and you eat too close to bedtime and you've had some type of sugar or some type of carbohydrate, you'll probably find yourself waking up more at that witching hour of that 3 a.m., 4 a.m. when you're waking up and you're wide awake. But that's kind of your natural circadian rhythm of how your hormones kind of work. And that is that time period. So the ways that you manage that is you move your meals back. Don't eat after a certain time. And if you do eat after that certain time, make sure it's a protein and it is not a carbohydrate or it's not a sugar. So put a protein in your body if you feel like you have to have something before you go to bed at night, not a carbohydrate. And then going back to that sleep and making sure that you have a good sleep routine. Diet is yes, go ahead.
I was going to say, my cardiologist told me last year to start grounding when the
Mhm.
sun comes up. Like I'm up and out. Well, not right now. It's just cold.
It's too
But
cold.
yeah, but I did it just consistently. When the sun is rising, that first hour it's coming up, get out there, put your feet in your hands, bare feet, bare hands on the earth.
Hmm.
And you have your face towards the sunrise for 10 or 15 minutes. And you do the same thing at sunset, 10 or
Hmm.
15 minutes, bare feet, bare hands on the earth. I cannot tell you how much more calm I was, how much more sleep I got. I got 8 to 9 hours a night, and that's unheard of for
Yes.
me. And even with the sleep spray, and I wasn't waking up. So that was pretty remarkable. And he also has me eating within an 8 hour window,
Hmm.
which I really started doing recently consistently. So probably about 7 a.m. until whatever that is, 3 o'clock in the afternoon, 4 o'clock.
Hmm.
Um, and I stop eating and I might drink a little bit, for a few hours after that, water. But that's been wonderful. That helps you stop that digestion. It just doesn't work. Your body's not working and waking you up at night. So I agree with you on that. And it really does work.
It does make a difference. And I can tell when you talk about the hot flashes and the night sweats. I don't eat a lot of sugar. I try to avoid it because it causes inflammation. It causes all kinds of problems. But when I do eat sugar, I can guarantee within 30 minutes I'm going to have a hot flash. If I eat it close to bedtime, I'm going to have more night sweats during the night because of the sugar.
I do that with dairy, caffeine, and sugar. I can
Hmm.
tell within 15 or 30 minutes I will have a hot flash.
Absolutely. So let me give you a tip and a trick about that. I'm going to go back to my essential oils because I love them. And there we do have essential oils. And one of the things that I really like, because like I said, I've used essential oils for years. Um, some of the bigger essential oil companies get really complex. And there's all these essential oils that they have. And you're like, oh, how do I choose? There's so many of them. I don't know how to choose. Um, there's a limited amount of essential oils that Jordan Essentials has, and they're the main ones. They're the ones that are most important. And then they even have the essential oils like the Copa-Calm that's going to have all of the Copaiba, the Yin Yang, the sweet orange, the chamomile, and the lavender. I love to diffuse essential oils, and I love to make my own kind of mixtures. But you can get these peppermint essential oil can be used as something to help decrease signals of hunger. So if you diffuse peppermint oil or have a peppermint oil roller ball or whatever, it can help you with food cravings and sweet craving sweets. So that's a little tip or trick that if you're craving sweets, go smell some peppermint oil and see how that helps you.
I love
But
that.
yeah, so that's a little tip with that. So to kind of give you kind of a big picture of this support, what you're really looking for during this time of perimenopause and postmenopause is you want to support um, your nutrition, you want to support your metabolic health. And the way that you do that is looking at the foods that you eat. You want to eat lean proteins. Protein is always first. That's one of your most important things is making sure that you get enough protein in your diet. That's going to help prevent muscle loss. Um, it's going to help your in it's going to help your overall well-being. It's going to support your heart. It's going to support your skin. It's going to support all of those things. And a lot of women are like, "Oh, I'm just going to eat salads." Well, guess what? Your body's going to go into like a starvation mode because you're not getting what you need. You're not going to lose weight. It's going to hang onto it even more. You've got to put calories in your body for your body to function. So protein is your number one. It helps stabilize blood sugar. Breakfast. How many of you actually have breakfast?
I do now.
Yeah. Breakfast is so important and starting breakfast with protein. This is a quick little trick in remembrance. You want to, within 30 minutes of waking, you want to have water, 30 minutes of exercise, exposure to the sun, and 30 grams of protein. So 30 grams of protein in the mornings. You had a thought, Kim?
Say that all again. 30 grams of protein
30 grams of protein
plus.
and plus um, 30 minutes of exercise, sunshine. You want that early morning sunshine, and you want water first thing in the morning. You should drink in the morning is water, not coffee. Drink a glass of water and then have your coffee. I'm not saying don't have coffee because I'm going to have my coffee, but drink your water first
And did you say to do this within a certain time of waking up?
within 30 minutes of waking up.
That's
Hmm.
what my cardiologist confirmed. So
Yeah. within 30 minutes of waking up. So some natural products that you can go along. Again, with the food, you need to make sure you have your healthy fats. Healthy fats are things like avocados, olive oils, walnuts, fatty fish. You can get your healthy fats from white cheeses, like the soft cheeses, not your processed cheese that's already grated. You need to get like real cheese. Um, Carbohydrates, if you're going to have carbohydrates, put those earlier in the daytime. Don't have carbohydrates after a certain time. Avoid long fasts. I know a lot of people, Kim, you said your 8-hour eating window, and that's great. Fasting too much can cause a rise in cortisol levels, and it can actually increase your insulin resistance. So you want to make sure that you're not doing like a 24-hour fast. You're not doing like several days worth of fasting, unless, well, for religious reasons, of course, that's an exclusion.
But if you're doing like eating within an 8-hour window consistently, is that okay?
Yes,
Or
that's
should I break
fine.
that up? Okay.
No, I think that's fine. 8 hours works great for some people. 12 hours works great for some people. You got to think about that, as well as what works for your body and what works best for you. And then some natural products, the magnesium. We've got lots and lots of magnesium products. Magnesium is very important. Magnesium helps with insulin sensitivity, and then it also helps with your sleep. Berberine. How many of you have heard of berberine?
I've heard of it.
Okay, so berberine is a natural um, occurring substance, but it helps lower your A1C. My dad is pre-diabetic. Well, he's actually diabetic, but he has kidney stuff, so he doesn't take his metformin. We switched him to berberine, and he's been able to keep his A1C around 6 on the berberine. So
How
that's
much does
really,
he
really good.
take?
He takes 500 milligrams a day. You can take up to 1,000 milligrams a day, but that helps with it improves your insulin sensitivity. Magnesium, again, um, helps with the cortisol levels. It can help calm the Copaiba, can help with the calming. That ashwagandha is also a good one to use to help lower your stress. Hot flashes. We haven't really touched on hot flash support, but we have our new line of the happiness hormones, which I love, and I'm going to talk a little bit about this one because there's several great things in here that I like. The yang yang and the clary sage, those help with hot flashes. Magnesium also helps with hot flashes, just FYI. It doesn't make them go away, but it can help with them. So when you have a nice little magnesium stick that has the yang yang and the yang yang and the clary sage, that can help with the stress relief, the calming. It can help with the hot flashes. And I'll tell you a little secret about the yang yang, and I shared this with Kim the other day. It also is an aphrodisiac. So that's another thing that kind of goes out the window as we're going through these perimenopause
Yes.
things is, and
Lowers.
yeah, it lowers your sexual desires. So the yang yang is a little trick there, just FYI. So, and then we need to focus on strength training. Strength training, again, is so important. When you get started, your muscles are going to be sore. So guess what helps with sore muscles? Magnesium.
Yes.
So everything that we go back to when we talk about these things, magnesium is such a foundational support for everything in our bodies. We need that. And Kim has mentioned her cardiologist several times. When I know I'm going to send somebody to the cardiologist, one of the main things, I always do a set of labs that I can send with them to the cardiologist. Magnesium is one of the things that I test for to make sure that their magnesium levels are where they're supposed to be, because it supports your heart as well. So it's really important to have your magnesium levels where they need to be. So your focus with exercise is with weight training, walking. So you want zone 2 cardio, not zones 4 and 5. I love zone 4 and 5 cardio. I absolutely love it. However, it is not good for me at my age. I don't need to hit those numbers the way that I used to. I
Right.
need to focus more on figuring out how to live in zone 2 and be happy with that. and I'm working on that. But the strength training, I do strength training 3 days a week. Berberine, yes, I have a question about berberine, and we'll come to that. I do strength training 3 times a week. I do Pilates in between that, and then I do farm chores and walking on weekends to get the rest of my exercise in. But you do get sore muscles. Recovery is important. One of the things as we go through these stages of life, our recovery, it's harder for us to recover. It's harder for us to recover from sickness. It's harder for us to recover from workouts. Magnesium can help support that. Um, so that's one of the things that you can do. And then your sleep, getting the proper amount of sleep and setting that intentional bedtime and wake up time, what you do before you go to bed, and it's consistency. It's consistency with all of these things, consistency with your skincare to make sure your skin stays good because it is your first layer of defense. You need to make sure you're taking care of your skin. You need to make sure that you're taking care of your teeth. You need to make sure you're taking care of all of those things as we go through these transitions. So we're about to our hour, so let's take some questions. Did we have any questions or thoughts or responses?
I did have a question, and I can't remember what it is now. Oh, sleep.
Mhm.
How long did you say is ideal to get good sleep? Is it 7 hours, eight
Seven,
hours?
7 to 8 hours of sleep. Psoriasis, yes. Oh my goodness. So, psoriasis, water, you've got to make sure you're getting a good water amount. And I do think that the skin relief would be a great help for the psoriasis to prevent and then to help heal as well, because the main thing is keeping moisture in your skin.
That's right, Tammy. It has seaweed, green tea, aloe, African shea butter. No fragrances to irritate you. I mean, it's just chock full of phytonutrients. Karen wants to know what's good for fatty liver.
Fatty liver, berberine can help with that. And then making sure your diet is on target. You have to make sure that you're eating healthy fats. So healthy fats are your lean meats, your fatty fish. Fatty fish is great for that. Making sure that you've got your carbohydrates and especially your sweets. A lot of people don't realize how much sweets can affect your liver as well, but sweets can do that. So just making sure that you're getting plenty of water as well along with that. Fatty liver is one. And so, when you go over to the other side and I think about medication, some of your GPL-1s, Zepbound does a really good job with fatty liver. They're working on getting that approved and targeted specifically for fatty liver. So if it's really on the more severe side, that can be something you could talk to somebody about. But for natural things, it's all about diet and exercise, all the things that we've talked about tonight.
Mara, you and several others are asking about where to get berberine. Sunshine Health Food Store here locally would be ideal. I'm
Yeah.
trying to move all of my supplements off of Amazon. I've heard
Mhm.
way too many people are getting not what they're ordering, and they're putting it in their bodies that
Yeah.
can be harmful, or just not effective.
Right.
So check out Sunshine. I know, Mara, you're local. Dawn says she's on Zepbound now.
Mhm.
And Cindy says, tell us about berberine.
So berberine is a natural substance. It can be used. It helps lower your A1C. It can help with anxiety a little bit. It also helps with cholesterol. A lot of functional medicine doctors use that as opposed to a torvastatin or some of the statins, because a lot of people have joint issues and different reactions to the statins. So the berberine can be used to help with that.
So it
Integrative
lowers not
therapeutics.
only A1C, but also your cholesterols.
Your cholesterol, yeah. It's a great little natural substance. And there's actually scientific studies that back that up. So, when we talk about berberine, when we talk about magnesium, you can find actual scientific studies that back up the things that we're saying here. I did my thesis when I was in school on natural and alternative therapies for perimenopause and menopause in women. So I did a lot of research on it. And the essential oils that we've talked about, yoga, those are the only thing that actually have some scientific evidence that show that it does help reduce the symptoms. So the evidence is there.
Excellent. Anybody else have questions? We're moving right up to our hour. Is there a subject that you want us to talk about next? Is there, like, we do a monthly class every single month, usually the first week of the month, 3 to 5 days. And we're so grateful that you guys joined us and that there was an interest for this time. And so we're really grateful that Kim spent time preparing. She's a very, very, very busy woman, but we're very thankful that she came and helped us. But if there's a subject, health wise or other, that you would like to tackle that you think our products can help come alongside and support, we would love for you to just give us some suggestions. Charla, we didn't record it. I'm going to ask Kim, not on the spot in front of everybody, but I'll ask her later if we can record this or download it for, putting on a private YouTube channel where we can share it out. Not necessarily publicly, but
Yeah, absolutely. No problem.
okay. Awesome. Christina, glad you were here too. She said it's very informative. Mara said it was so informative. Dawn said, thank you for this. It's been very informative. Everybody's loving this. We really do appreciate you because, we're doing the best we can, but we don't know a lot.
And the sad thing about it is that a lot of practitioners don't necessarily know a lot about it either. It's not something that we're taught in school. It's really something that we have to go out and get the information for on ourselves. And, I think that it's time, if this were, and I'm just going to say this because, the estrogen filter that we talked about is gone. If it were a man problem, there would be talk about it all the time, but it's not. It's a female problem, and females tend to keep all of our stuff to ourselves. We don't talk about it.
Handle it ourselves.
We just handle it ourselves. We just deal with it. There's ways to help and there's ways to support it, and you don't have to be miserable. So those are the things that, that I want to get out there. You're not broken. This is a normal process. So many women get put on antidepressants and anti-anxieties, and really we just need to look at what's going on behind the scenes. Women become diabetic because of the insulin resistance, and no one talks about. How many of your doctors have ever talked to you about insulin resistance? Did you know that insulin resistance can start 10 years before you're ever diagnosed, even with prediabetes? You can have an A1C of 5.1, which is excellent, and still have insulin resistance and still have the problems that a diabetic would have because you're insulin resistant. So, those that's just information that you need to get out there, and you need to know. And you can have thyroid problems without hitting those numbers too. So.
Yes. I did want to ask, if you would comment, we want to know what is the one thing you're going to do tomorrow differently than you did today?
Yeah.
Based on this little hour that we spent together, what is one thing that you are going to do differently tomorrow that you know that you can do, you can bite it off and chew it, and you can handle this? What are you going to try tomorrow and work on tomorrow? Comment below and let us know what you're going to be doing tomorrow differently.
And I'm going to say this too. One of the things that's so important as you start making changes in your life is to have the community that supports you. And this can be a really good community to be able to support what you're doing and the changes that you make. Drink more water. Yes, drink more water.
Yes, 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 yes. Patty said, yes, they discussed it with Mr. Sent me to a nutritionist.
Cool. Yay.
Water first and coffee. Tammy Lane? Yes. Christina, she's going to start with drinking water when she wakes up.
Walk,
Excellent.
walk. Love
Mara's
it.
going to do
Walk.
water first thing, coffee later on. Stacy's going to take a walk. Good for you,
Uh-huh.
Stacy.
Take my
Tammy's going to
berberine.
find some berberine. Brenda Garrett's going to use more magnesium. Sharnetta is going to exercise more and walk. Tammy's going to do more walking. Patty's going to take her berberine and low impact exercise.
Yep.
Dawn's going to start eating something for breakfast.
Okay.
Maybe fruit and
Yay.
yogurt. Make sure you get some protein too, maybe a boiled egg or two.
Mm-hmm.
Right?
Yep.
I mean, yogurt does have some protein, but you're going to get some
Greek,
carb.
Greek yogurt.
Greek yogurt, right? Cindy's going to go find her some berberine. Do you have a local health food store so you can kind of stay off of Amazon with your supplements, I hope? Carol, more protein for breakfast. Yeah, Carol.
Yes.
I love this. So you guys, like, yeah, you heard and you internalized some of this, and this is good. Yogurt is protein. She makes her own yogurt. Oh, that is so healthy,
yes.
Dawn.
Yeah.
So healthy. I did that. I used to use the Instant Pot for mine years ago. All right. Well, you girls are rocking it. You're doing a great job. And again, Kim, we thank you. And I know you're in the group, through tomorrow. We're going to keep this group through tomorrow. We're going to be doing some prizes. And so make sure you participate. Girls, go back and participate on every single post, because you don't know. You might get an entry on every single post that way. We'll be giving away a prize for that. We're also going to be giving away gift certificates, shopping sprees. And so we want you to make sure you place your order with your consultant today and tomorrow. Get those Joyful Jordan boxes for $30. Get those bundles that we have, the Better Sleep bundle that Kim talked about tonight. Make sure you add the $5 eucalyptus shea butter. It's in a big tube. We only carry it once a year, maybe once every 2 years. And it's really good. It's like an alternative for that VICKS product that has petroleum products in it, which you don't want to put on your skin. You don't want to absorb that. But the shea body butter with eucalyptus, yes, you do want to. And it's very good for opening you up, opening up your airways. So you put it on your chest, you put it on the bottoms of your feet and rub it in. So those are two really great places to put it. So that's a $5 special with a $50 order online on your consultant's website. So be sure that you add that or you redeem that with the little redeem button at the very end at checkout. Yes, so good. Okay, so make sure you get all that you need. The happiness hormone spray, the peace spray, that's my personal favorite until the happiness hormone. I will alternate those now. But the peace has the ylang, the clary sage, the patchouli, the lavender. It's really, really good. It smells really good too. So I like having we call it the huff stick, where you huff the stick, you can put it on you different places, but you can also smell it and breathe it in for that aromatherapy. All right, y'all. Thank y'all so much for joining us.
Looks like there's another question, Kim.
Oh, we do?
Can you purchase something? I didn't see the rest of it. I can't see all the...
More than one of what, Karen? Can you purchase more than one of what? And Tammy Lynn Lane, she loves the peace stick. She lives on that at work. People drive her crazy, and so she has to go smell her peace stick. All right, Karen, what can you purchase more than one of what? If you're talking about the
eucalyptus.
The eucalyptus, you can't purchase it. It's the $5 special. So it's one per order. So if you want to do multiple orders, yes, absolutely. You can get more than one of the eucalyptus shea butters, but you have to do them per order. So for every $50 order, you can add the $5 special. Yeah. And don't forget to get your Joyful Jordan box. Oh, and the new Fresh Line Mint product. The whole line of Fresh Line Mint is so good. It smells amazing. It's very bright. It's lime, mint. Oh, so good. But the Joyful Jordan box has these two, the Copa-Calm roller, the Dead Sea Salt Copa-Calm, and then the big, yes, thank you, the big toner. I sold mine already.
So yeah, the big toner that I absolutely love.
You put it all over your face, all
Yes.
over your body if you wanted to. All right, girls, thank you.